So BEAR stands for Bridge Enhanced ACL Restoration. It's an implant that helps us heal your native ACL. During the procedure, we repair your ligament back to the bone, and in between we insert a collagen-based scaffold that acts as a bridge for the two torn ends of the ACL.
So the ideal candidate for this procedure is a patient who has sustained a partial or complete ACL injury that occurred within the last 50 to 60 days that has some tissue that we can actually repair. If we see that on an MRI, we'd like to be able to offer that to our patients because this is a completely different procedure from what we used to do.
So some benefits of the ACL repair versus the ACL reconstruction are the improved pain following surgery. With an ACL repair using the BEAR implant, we do not have to harvest a tendon from the knee. So the immediate pain after surgery is usually less and improved when compared to the reconstruction.
Patients have less pain in the immediate first days after surgery, and they also have less scars. They seem to recover their muscle strength much quicker as well.
I have had some patients that have actually returned to work within a quicker timeline following ACL repair than standard ACL reconstruction.
So I was able to perform the first BEAR ACL in the state of Pennsylvania on July 15th of 2022. When I was given the opportunity, I was very interested in this because this I knew could completely change how we're going to treat ACLs.